Thank you for joining us. We are a few minutes away from starting this very exciting COVID-19 Vaccine Introduction Workshop. Who knew that before the end of 2020 we would be hosting this kind of event as part of the COVID-19 Peer Hub activities. Our guest for today's workshop will be Dr. Ann Linstrand from the World Health Organization. So she is the co-lead for COVAX, the facility, the coordinated global system to introduce, to share, to make sure that COVID-19 vaccines reach countries and reach those who most need them. So stay with us. We'll be starting in just over 3 minutes. And we will be looking at your comments and questions. So if you haven't already, we can see there are many people joining now on the various social media platforms. Do let us know where you are connecting from, so your city and country. And in fact, we have here, thanks, Steve Felix Udu, who says, a step ahead of the curve. So that is certainly, let me just get myself out of the way so you can see the comments. This is very commendable, a step ahead of the curve. Thank you, Steve. Yeah, there's a lot to say, and we're looking forward to the discussion with Ann Linstrand, who's really, front and center, leading the global effort together with other global partners, and of course in support of countries. So we're just over 2 minutes before getting started. Do share your comments and questions for Dr. Ann Linstrand. Let us know who you are. Tell us where you work, what you do, the city and country you're connecting from. So thanks, Steve. You are signing in from Abuja, Nigeria, and we're looking forward to many more comments and questions. We are looking at them, and as you can see, we are sharing them on screen, and we're actually live on LinkedIn. So we know that some of you are increasingly watching us on LinkedIn. We have you can find us on YouTube as well, Twitter, and Facebook. So we'll be getting started in just over a minute and a half. See you soon. Welcome to you. I'm Reda Sadki from the Geneva Learning Foundation. We are live today for this COVID-19 Vaccine Introduction Workshop. So just to be clear, this is not an introduction to the COVID-19 vaccine. It is about how countries are going to be introducing this vaccine to the people who most need them. With me in the room are a group of scholars, immunization professionals from over 90 countries who have been working together for the last 6 months in what we've been calling the COVID-19 Peer Hub. I want to welcome all those of you who are watching us on LinkedIn, YouTube, Twitter, and Facebook. Across all of these platforms, we're looking at your comments, and I'm actually going to mark a pause before we welcome our guest and get started with the workshop, just because I'm not going to be able to share everyone's greetings. So first of all, before we had even started, Steve Felix Odu, who says a step ahead of the curve with this workshop. He's signing in from Abuja, Nigeria. Udoji Danjuma, all from Gusau in Zamfara State. Muluken Tesfaye from also via Facebook from Addis Abeba. And let's see, we have Steve Mwangi from Kenya. Edovi Roberta David from Nigeria as well. Madan Katiwada from via LinkedIn says hello everyone and thank you TGLF team and thank you Stephen Mwangi. All right, so what is the agenda for today? Again, before we get started, a couple of announcements. This is an activity of the COVID-19 Peer Hub. This is the final week for the more than 700 participants in the Peer Hub who have developed case studies looking at how they were able to move individuals or groups from hesitancy to acceptance. Now, later today, we'll be having part 2 of a mini-series on sero surveys. So this is must-see TV if you work in immunization and you're interested in this topic. Tune in at 2 p.m. Geneva. You can find us again on all the platforms. We're doing this with the International Vaccine Access Center. And then tomorrow, we'll be really digging in, deep diving with Professor Heidi Larson about vaccine confidence. So precisely the topic that Peer Hub members have been working on, developing case studies. So that is what we'll be working on with Heidi. Last but not least of the announcements I have for you today is the Teach to Reach conference. So really, the ultimate challenge in how we teach to reach is really the COVID-19 pandemic, and 26th to 28th January are the dates. In the coming hours, we hope that the announcement for the Teach to Reach conference and registration will be available on learning.foundation. So let's go back to the room. We have many scholars in the room, and I'm looking for Ann, our guest, Ann Linstrand. It's just a very fast shifting list of names. So let me make sure that we bring her into the. Whoops! All right, almost there. All right, one more try. Whoops. Yes. Okay. So. All right, so let's go to Ann, and let's start with the first question. Really, if Ann, you could kindly introduce yourself.
Hello, everyone. Delighted to be here. My name is Ann Linstrand, and I'm a unit head of the EPI program in WHO in Geneva. I'm really looking forward to discussions and hearing, what are your questions today? What are you facing in your daily life in preparation of the COVID-19 vaccines?
Great, thank you, Anne. So my first question is, there seem to be a lot of acronyms and structure at the global level. Can you help us make sense of all these acronyms and the complex structure that's been established to help international agencies work together? And beyond the acronyms, what is important, what is significant about this global effort from where you stand?
Well, the Act A, the brilliance of that Act A, it's accelerated access to tools for stopping the pandemic. So diagnostics, vaccines, and therapeutics. That is a collaboration between many different organizations to try and get the tools out to stop this pandemic. It includes the vaccines, but also the diagnostics and therapeutics. I think that we've all seen what the pandemic, how the pandemic affects our daily life, all of us. Loss of family members, the work that every healthcare worker in the world has been facing this last year, of trying to respond to the pandemic. And then how we've been locked in and reducing our social contacts. It's time to stop the pandemic now. And I really think that the few tools, and particularly the vaccine, of course, will be immensely useful, as particularly since we've seen the first steps of efficacy data that we see that this vaccine seems to be, these vaccines, because there are several, seems to have high efficacy and being safe. So fantastic news for the world in the steps to stop the pandemic.
You've been, of course, at the forefront of this response, of the world's response to the pandemic. Did you expect to be before the end of 2020 to be discussing the practical aspects of how vaccines to protect individuals from this virus were going to be distributed and made available?
Never, never, ever, never, ever has there been such collective international effort to do the research and development of these vaccines in such a speed and scale, and with collaboration between researchers in the whole world to get this done, to do the clinical trials according to the really proper protocols, and do that in collaboration across many, many countries. And then do the production. And actually, we're now at the step of a few countries have already introduced, and we're on the verge in 2021 of a massive introduction in almost all countries of the world at a large scale. So by the end of 2021, 2 billion doses at least will have been distributed through the so-called COVAX facility.
So, Anne, I know that you have managed national immunization programs. You have obviously been working at the World Health Organization on the global, what used to be called the expanded program on immunization. But is there anything in your professional experience that has prepared you for the challenge that you are tackling now, working with many others at all levels?
I think it's a stretch, but it's also fantastic because everyone is walking unknown territory, but actually doing their best to make it happen. So I think no one has ever done this before. The world has never done this before. So we're all like trying our best. And so far, I think, just getting the first vaccines into safe and effective vaccines out into people and the highest risk group for COVID-19 vaccination. I think it's already a fabulous enterprise, and I'm very humbled to be part of it. And there are so many people like yourself. Every step counts here. Everyone needs to play their part, and the majority of the work will be done in your different countries, and the real challenges comes there actually, because countries are facing both the COVID-19 pandemic and has been very stretched in the healthcare system, and then now on top of it needs to do a massive vaccine introduction on top of it, and I know the efforts have been very stretched, and there is a search even more needed in 2021 for delivering these vaccines to the people that need them.
Thank you, Anne. So let's see what that looks like now. I'm going to ask the participants in the room who are members of the Peer Hub, who are immunization staff from countries, of course, affected by the pandemic. And I'm going to ask you to raise your hand if you would like to tackle the questions that we have prepared for members. All right, there's already three hands. Let's start with Atahir Abubakar. Atahir, I don't know if you're going to be... Okay, there are just too many names in this room for me to ask you to unmute. Please go ahead. You should be able to unmute yourself. Atahir?
Yeah, I've done that already.
All right. Yes, the floor is yours.
Yeah, good morning, good afternoon, good evening. It's a very delighted period for us to be part of this great activity in the world. COVAX is COVID-19 vaccine is coming in. Currently in my country, Nigeria, we are experiencing the second spark.
Atahir, hang on.
We know you. In the positive cases.
Atahir, could you first introduce yourself? Tell us who you are, what you do, where you work, before you dig into the questions.
Sorry, I'm excited.
That's all right.
Yeah, I'm Atahir Abubakar by name. I'm supporting Zamfara State Primary Healthcare Development Agency, routine immunization as a technical officer, supporting immunization in the states. under the National Primary Healthcare Development Agency in Nigeria, who are the custodian of routine immunization, both SIA and routine in the country. That's why I work as a technical assistant. So thank you very much. Sorry, I was supposed to do that early, but I was excited because of the nature of what is on the ground. Currently in my country, we're experiencing high spike of the COVID positive cases. Just of recent, most of the states are closing schools because of the fear of infecting pupils. So my question goes like that. The country are trying to do a lot to provide this vaccine, but what are the what guarantee do we have that AFI may be managed immediately? Because the fear of every person in the community or even in the health sector, what will be the possible side effect of this vaccine? Because when we are reading online, the Pfizer vaccine that was started in England, there are some little side effect, though it was not made clear what are the side effects. So what preparation are we making in order to tackle this thing immediately it happens? Because if we allow it to escalate, it will drill the process all over. Thank you very much.
Thank you, Attahir. And indeed, we shouldn't be surprised that the first question is a safety question. And what, and obviously, there's been a lot of work around that question. What is your answer for Attahir and other immunization professionals who have this question?
I think, Attahir, this is really the key question. So far, the clinical data that has been released of all vaccines, including Pfizer vaccine, have shown a very good safety profile. And so the importance for you, I think, in each country is to have your own systems of monitoring, but also plan ahead. So do a risk communication plan ahead of a time. Who will, how will it be reported? How will you evaluate the safety incidents? Who will then decide on what measures to take in case there is a safety signal, and then have the risk communication material almost ready in advance, because this needs to be, I totally agree with you, dealt with as an emergency if there are different safety signals coming out. We think, and these vaccines have been tried in tens and thousands of vaccinee. So the Pfizer vaccine, for example, was tried in 40,000 and there was no safety signal like this. When they introduced it in the UK, there were 2 allergic reactions. And so they've taken the precautionary level of, avoiding people who've had severe allergic reactions before. In the meantime, they're doing a thorough investigation about what was this and how did it come across. So I think that thank you for the question, because I think we need to make more public what actually happened with those cases. So I think knowledge and truthful communication about the vaccines, the possible side effects, which are fever, muscle ache, sore arm, etc. Not anything serious, nothing that has, been giving any long-term side effects. Even those 2 cases were handled well and no safety long-term. However, we should know that a few vaccines have been introduced like this in good clinical trials, tried in tens and thousands. And then when they are introduced, there might show up some really, really rare side effects. So we need to have a preparation. And that's exactly what, you were saying, to have the communication around having a safety committee that can look and scrutinize the safety signals coming in, and based on your local, in Nigeria, safety monitoring systems that will be in place. I think you have DHIs too in Nigeria, right? So actually there is now being a module built that can be put onto the DHIS2 platform. And it's piloted now and it will be rolled out. So using your platforms already in country to do that safety monitoring, but then the action has to follow. So acting on the safety signals. And at the global level, we're putting it together a committee of experts who will be receiving safety data from the whole world. And the same way at the global level, there will be the safety team looking at every event and be able to come with talking points, actions needed, maybe halting vaccination if we see something is coming up. I mean, so preparations is key here.
Thank you, Ann and Atta here. So the rule of the workshop is that we have one presentation, one presenter per country. Atta here, and I also want to remind participants that there's a set of questions that you should be able to see up on my screen, and these are the questions that we'd like you to answer, to explain how, wherever you work, whatever level of the system, how you are involved or expect to be involved in COVID-19 vaccine introduction. And Anne is here, of course, to answer questions, but she's also very interested and very keen on listening to what your experiences are, how you are thinking about this. So now that we have the safety question, at least with a clear response, let me go to Maria Monzon, who will be our next presenter.
Hi, good morning, everybody. I'm Maria Monzon. I'm from Argentina. I'm a pediatrician. I work as the director of a health center in a small city in the northern part of Argentina. Very excited to meet you, Anne. How are you?
Good, fine to see you.
Thanks. So I have never been involved in the introduction of a new vaccine. So I think it's a big challenge ahead of us. I did, like you said, nobody's prepared for this. So there are a lot of scenarios that we're looking into. I actually was a bit more, I work at the local level, so I'm not in the decision making, but that really didn't stop me. I got a lot of courage from being part of the Peer Hub and of learning a lot with the Geneva Learning Foundation. So actually a couple of weeks ago, I presented a plan, a suggestion as a strategy for the how we were going to, introduce a vaccine here in the city specifically, and in my context. This is a small city. It has about 500,000 people. That in Argentina, they're huge cities. And so one of the things that I had prepared, and I wanted to know if that's something that you've heard of in other things, is that one of I think the challenges here to introduce it is going to be where do you get the demand, or where do you get the, a listing of who you're going to vaccinate in which stage. So obviously everybody goes, first health workers, and then essential workers as, police officers or armed forces or whatever, and then over 65. Okay, so you go step by step. So one of the things that I had presented as a strategy, as a macro plan, I didn't actually go in detail, was because here elections are mandatory. So I thought, okay, everybody that is over 18 has to vote. So we already have lists. We already have all the logistics for people to go to schools, where is, the places where we vote. So it's like, we just had to get those lists and just, do, okay, over 65, everybody knows where you have to go to vote. And, well, sadly, this is something that is being, solved in a political level that not all of us are involved in. And so everybody is like, okay, the city is following the provincial, guidelines. The guidelines from the province are being followed by the nation, and we really don't know how it's going to work out. But I wanted to know if what are these strategies that you're looking as more common or that are going to work. I think that demand here is going to be a big challenge, because you look at, I've been doing a bit of research in my area. My health center works with about 7,000 people, and it's not going to be a high demand because I think people are scared. It's what we've been saying, right? Hesitancy about the vaccine and everything is a big deal. And it's not like the flu season where everybody is lining up and they're fighting, each other to get the vaccine. Here, I think they're going to want everybody else to get vaccinated before somebody goes and actually says, I want the vaccine. How can I get it? So I think that's going to be a big challenge for a lot of us.
Before Anne responds to that, just want to acknowledge the many good comments coming in from the social media platforms. So I want to highlight Edda Kanini's comment. She is joining in from Kenya, and she says, great discussions and planning to fight this pandemic. Back to you, Anne, to respond. I think there's several issues intertwined in what Maria shared. What would you like to comment or share in terms of feedback for her and others?
So, Maria, I think it's really encouraging to hear your taking your peer hub learning and just go for it. I think it was a brilliant idea to look at the election, the election list, and go from there to find those above 65 years of age. I think, the main target groups here, it's the healthcare workers, the elderly above whatever cutoff the country decides according to your national guidelines, and then the medical risk groups. And some countries will make decisions a little bit different than the other decisions, the other countries, depending on where you are in the pandemic, where do you think your risk groups are, et cetera. So we see that the national immunization technical advisory groups take a little bit of a different take on the global recommendations from SAGE. But the majority will try to reach the healthcare workers and the elderly first. I think what is more tricky is in many countries, finding the medical risk groups, because many countries don't have lists of the medical risk groups, both because it's confidential and medical secrecy and so on. So I guess every country has to figure out how to reach those. Is it through the general practitioners? Is it through the hospitals? Is it through an open call and say, please come if you are included in these different groups? Some of the regions, I know, for example, Sierra, maybe somebody from Sierra could tell me, but I know that the WHO region in Sierra was talking about actually going, for example, in India, door to door and find out and make the lists in advance of who should be eligible for the vaccines, in checking at the house, where do you have the elderly and the risk groups? So I think it's going to be, and people will have to invent like you're doing in Argentina and your parts of the country as well, and finding the best way of finding those. The second piece you said, I think is so crucial, and it's linked to the question from Atair. It's about the demand and hesitancy. I think no vaccines will be effective to stop this pandemic if it stays on a shelf and nobody wants to take it, right? So I think it's important with messaging about how these vaccines were developed, how the mechanism is of the vaccines, and making public the trial data, and making communication around how they are evaluated at each step of the way in the clinical development, but also mainly in the regulatory authorization. So no vaccine comes on the market unless they have been scrutinized by a regulatory authority, as you know. And WHO, the PQ, is used by many countries as a good standard, and I know they're working very, very hard in the PQ team right now to have a rolling look at each data that is there, and then communicate that how the clinical trials were done, how the regulatory authorization is done, and maybe how it's done in your country as well, for the final approval to be used in your country. And then I think it's also about community engagement and getting everyone excited about, can we help each other to stop this pandemic? So messaging in the communication and the advocacy about the value of vaccine and the historic value of other vaccines, and how we collectively can help stop this pandemic by agreeing to be vaccinated. And then I think also learning very early on, we're trying to put together implementation learning. So early on, make public, any safety data, any efficacy data, and also see the effect in countries where many people accept it, so see the effect on the pandemic itself. I think that maybe each country will be different. So if you're saying in Nigeria that you now have a second wave, in Europe is very hardly hit. So I think that the willingness to get vaccinated, it is also depends on the epidemiologic situation of the country, right? So if you see your family members get sick, maybe die, you're more motivated to take the vaccine. So I don't know the situation right now in Argentina, if you're on the high peak of epidemic in many cases or not. I think that will play a role as well.
Yeah, we are waiting for the second wave to hit us anytime now. Yeah. But thank you so much. That was very nice of you. Thanks.
Thank you, Ann.
Good luck, Maria.
I want to acknowledge some of the great comments on Facebook, LinkedIn, YouTube as well. Thank you for following us on all these, across all of these platforms. Alumra Umar said confusion is mainly due to media coverage regarding all available vaccines in the market. And then we have some quite comprehensive comments. I'm going to put one up because I think it's, so this is from Nilanjan Roy, who works on surveillance in Meghalaya, India. And so he actually answered the questions. Yes, I have been involved at the state level for new vaccine introductions. I would also be involved in the COVID-19 vaccine rollout, and preparatory processes are underway in terms of cold chain space, identification of beneficiaries, and preparing a database of the same. Yes, being a new vaccine, we're likely to face some challenges in terms of acceptance in certain areas. So I want to put that question in a kind of general way. If I am an immunization, I work in immunization in a country, at the district or health facility level. So I'm not working on the national planning. What do I need to know at this stage? And what can I do if I want to be one step ahead? What can I do? Where can I find reliable resources that can help me get ready? Maybe while the folks in the capital city are working on the national planning, would you recommend that I go, for example, read the guidance on developing a national deployment and vaccination plan for COVID-19 vaccines that was released in November by WHO? Even if I am not directly involved in the planning, where else can I find reliable, credible information?
So on the website, we have a website called the Country Readiness and Delivery. And we have at the moment 3 tools. One is a tool for a checklist, which is called the VRF 2.0. They have different ones. The second one is what you said, Reda, the National Deployment and Vaccination Plan. And the third one is a costing tool, which maybe mainly will be used at the national level. I think it's a brilliant idea to read the guidance on the National Deployment and Vaccination Plan. I actually reread it before I came in to discuss with you, and it gives a very good overview of the steps to take and the issues to be mindful about. And those are just as relevant at national as at subnational level and at local level anywhere, about the mindset, what kind of delivery, because even if national will make the big guidance on what are the target groups, how many are them, and what is the strategy, the cold chain capacity, etc., you will also at subnational level have to make a detailed plan about the delivery, logistics, and think about, will we use the marketplace or the public primary healthcare facilities? Will we use the local hospital or a school? Where will we be vaccinated? How will we get organized? I mean, everyone has to to think about and adapt the delivery systems at every level, right? And I think go in advance and think about it. It's really the local solutions that will be, the success to this. And the more you prepare in advance, the better it is.
All right, I want to go. I want to call again for a volunteer from the COVID-19 Peer Hub to take on the questions, which you should be seeing on your screen if you are with us in the Zoom room, and really asking for Ann Linstrand, who works at the headquarters of WHO, who's actually quite keen to listen as well as answer questions, but to hear how you're involved, whatever level of the system you may be working at. And again, just a reminder of the rules are that only one country, one person from a specific country will present. We've only heard 2 presentations so far. So if you are from Nigeria or Argentina, unfortunately, we won't be able to hear you again. But I see Amel Altaher. Amel, I'm asking you to unmute. The floor is yours.
Thank you, Rida. So this is me, Amel. Actually, I'm from Sudan. I'm working as International Technical Officer supporting polio program in Pakistan since last 5 years. So coming to answer the questions, yes, I was involved in the introduction of new vaccines in past. Like in my country, in Sudan, I was involved when we introduced the IPV, also for Rota vaccine, BCV, and pentavalent vaccine. Currently, although I'm sitting here in Pakistan, but remotely, I'm involved in COVID vaccine introduction in Saudi Arabia, the place where I'm living now. So since last 2 or 3 months, so I have been involved in many TOT. So far, up to yesterday, I'm one of the master trainers. So we are targeting the healthcare providers, like the country in Saudi Arabia. They have started yesterday. We have launched also one application. We are asking the community who are willing to get the vaccine. So so far we have done like 11 sessions targeting only the healthcare providers, mainly about vaccine. My other involvement was also 2 months ago when we were doing the assessment of the cold chain across the country. So this very, very summary answer just to the listed questions, Rida.
Great, thank you.
The main challenge now we are facing, because in that app, we have been daily evaluating the response from the community. One of the main challenges now, they are saying that this vaccine, it has been produced so fast, so we are not sure if it is safe or not. And the response, what we have seen yesterday, like 60% of the people who answered that, they were saying, no, we are not going to take the vaccine currently. It's over to you, Rida.
Thank you, Amel. Let's hear a second presentation. So again, a different country every time. Let's go to and the countries that we have heard are therefore Nigeria, Argentina, Pakistan. So I see many hands raised. Let me go to Dr. Nada Ahmed.
Okay.
Nada, are you able to speak to us?
Yeah. Thank you. Good afternoon. I'm happy to be part of this workshop. So I am from Sudan, like Amel Tahir. I was the EPI manager for 4 years, and now I'm working for an INGO. It's work in different country, but currently I'm involved also with as part of community physician initiative to support the Ministry of Health Sudan in introduction of the vaccine. So based on my experiences in Sudan, we experienced actually the introduction of the vaccine, and sometimes it's actually impacted with the rumors, and sometimes it led to holding a whole campaign of vaccination due to like a widespread rumor, and then usually with the help of professional, we resume actually the introduction, and we have a very successful introduction in Sudan for different vaccine. But now what I'm observing, like the debate about the safety of the vaccine is among the doctors, despite the high mortality. I mean, now we have quite, let us say, big number of health workers that they get the infection, and we have high mortality, especially in this last 2 months among the senior doctors in different hospitals in Sudan. But still there is a debate about the safety of the vaccine and this short time for production of the vaccine and all these things. But here also I want to highlight regarding Sudan capacity, regarding the system capacity in surveillance of the adverse event following vaccination. So even if the country managed successfully for the introduction, I'm not sure about the capacity of for the adverse event monitoring and all these things. So I think it's the area that need to be addressed. Yeah.
Great, thank you. Thank you so much. Thank you very much indeed. Let's hear one more presentation from a different country. So if you are from Nigeria, Argentina, Pakistan, or Sudan, please lower your hand. But otherwise, let's hear from, all right, let's go to Beyanwu Peters. Beyanwu Peters, the floor is yours. Beyanwu, are you able to... unmute? Your hand is raised.
Good afternoon.
Yes, welcome. Please tell us where you're from and what you do.
Yeah, I'm Benyau Peter from Liberia. I work with the EPR Ministry of Health, Grand-Bassa County, one of the county in Liberia. I'm the county EPR supervisor. So I'm privileged to be part of this meeting today and privileged to speak on the issue of the COVID-19 introduction process. Unfortunately for me, for the question, I was involved in the introduction of, especially the HPV vaccine last year in Liberia. And we will have a lot of challenge, and some of the challenge were the issue of the coaching. Because the issue of the vaccine is one-to-one dose, so it carries a lot of space with the coaching issue. Because if you have one dose of vaccine, you have huge capacity to carry with the coaching. And one of the challenge was the issue of the HPV vaccine is different from our routine vaccine. So introducing another age group into routine immunization were quite different, especially for our healthcare provider at the health facility level. So it was quite difficult to adjust to that new age group adding up to that vaccine. So the issue of coaching, the issue of the new age group 9 years, because in Liberia we are dealing with 9 years exact with the HPV vaccine. And with the issue of the COVID-19, yeah, we are on the way. I'm the county EPR supervisor, so I usually participate in the issue of macro planning when it comes to macro planning for introduction of new vaccine. So at the national level, we have people who do application process and so on. So when it comes to my level, I will participate in the issue of, I will participate in macro planning, where we do macro planning with human resource, capacity, coaching. So at my level, at the county level in my country, I will participate in the country when it comes to new vaccine introduction. So what is your role at the country level? And my role will be that I will, as a county supervisor, I will participate in the county level. Like I said, macro planning and strategic planning when it comes to human resource. So what would be the challenge in order to introduce the COVID-19? Like I said, the issue of coaching will be one of the major challenges in my country, coaching. Because the vaccine that's coming will require a lot of coaching, and with issue of the community engagement, demand, it will be one of the challenge, because a lot of people are fearing that the vaccine is not safe, the vaccine is that. So, but personally, we are trying to engage how well to create more awareness on this vaccine, that because we have the issue of Ebola in our country. Before, people were still thinking about Ebola vaccine, but we'll still try to create more awareness, and we have COVID on our head already. So we'll try to raise more awareness. So the plan is on the way to see how we can engage the community, engage stakeholder, to see how best we can engage on that. Then what do I expect to face with the vaccine hesitancy? Yeah, there will be a lot of challenge with the introduction of this COVID-19 come next year, especially with community acceptance, because a lot of people will be a lot of vaccine hesitancy, especially with the issue of COVID. So we are trying to put more emphasis on community engagement and awareness, that people can be able to accept this vaccine. So that's from a point. Thank you so much.
Thank you. So we're discussing with Ann Linstrand about the introduction of COVID-19 vaccines, a discussion that looked quite unlikely that we'd be having this kind of discussion before the end of the year. We've heard contributions from a number of countries, from Nigeria, Argentina, Pakistan, Sudan, and Liberia. I want to again acknowledge the great discussion that's going on the various platforms, and especially on Facebook, between Dr. Tanushree Mandal, Alumra Umar, Ahmed Suleiman Anassam. I apologize, we obviously are not going to have the time to get to all of the great questions and comments that you are sharing. I do want to acknowledge a few, just to say hello back to Jojo and Zengu, who sends his greetings from DRC. Dr. Mansi Mathur, who adds that the government of India has released guidelines for rolling out the vaccine to healthcare workers and the rest of the population. Let me see. I know there were a few. And just Alumra Umar says, for me, I find it difficult getting estimates of over 60-year-old people and people with comorbidities, as getting data in a country like Somalia is a challenge. So that's about fragile contexts. And Ahmed Suleiman Anassam asks one of the elephant in the room type questions. So he sends greetings from Ghana. I want to know whether Ghana is part of COVID-19 vaccination program, and is it going to be free? So there's a lot there for you to respond to and share your comments on the 3 country presentations of immunization staff from Pakistan, Sudan, Liberia, and perhaps even address some of the concerns shared from our commenters. Over to you.
You know, I'm really grateful to hear all your comments, and many of them are circling around the safety and the vaccine hesitancy and how you will actually manage to build trust wherever you are in the world for this vaccine. I hear from Pakistan. We will. I just received the latest guidance from WHO, key staff in communication and trust and demand acceptance work this morning, and so it will be published very quickly about the importance and how to do social listening, how to digest that and tailor programs and tailor communication. How to write a risk communication plan. Maybe some of those guidance will be helpful for you. But I think it's also what you were saying, what was it? Benangwu, you were saying from Liberia that the community engagement will be key here, that you probably, build a coalition of community engagement and have that social listening from that group somehow. It will be different in every context how you do that, but the importance to have the feel of the pulse of where the information flows, what are people saying, what are their fears, and then tailor the messages according to what people are worried about. There will be lots and lots of information continuously going on about what I said, the reporting of all the safety data of, the introductions that have already started in many countries, and how to message that. The whole WHO is mobilized with the scientific evaluation of these vaccines and the importance and the effect it will have on the pandemic. So you will get a lot of data, which I think it's also important to have. But I think it's also a matter of like attitude and listening to and being there. I mean, there are unknowns. Even if these vaccines have been evaluated according to all best evidence that there is and been tried in the best clinical trial, there might be, as I said, rare events coming up. And how then to communicate that back into in a fair way. It's about the how, right? It's about how we talk with the people that are going to be vaccinated, reassuring them, and not the least, as you said from Sudan, Dr. Nada. And I think that is key. What you're talking about, the challenge of having actually healthcare workers themselves being careful and fearful or having doubts about the vaccination. That is the key thing. Unless we health professionals ourselves can, and honestly say, I would take that vaccine. I think it's important. If they still have some fears, we need to start there, because the community health workers, the health workers of the primary healthcare center and at every level need to have access to the proper information about these vaccines and the efficacy and the safety and how they work, everything, to be able to communicate and transmit that trust to build acceptance for the vaccines. And if the doctors are fearing, then we really need to start there, training modules, etc. We're building training modules, and I'm sure that is happening, as you said, in many different countries as well. Training modules on some of the key concepts, and one of them is hesitancy and demand, and one of them is how to do safety monitoring and the risk communication around that. So very soon in January, you will see modules coming up on the WHO website, which may help you to get that language and get, which of course has to be adapted into maybe local language or something, but at least it will help in the first initial steps for a good training at every level. We all need to learn, right? Because these are new vaccines. We all need to learn and constantly learn. I'm learning every day because new data is coming up, and you have to adapt and see what you learn more. I think that was the main things. Oh yes, thank you. All of you have started to do what you know you need to do in the new vaccine introduction, and that is the cold chain assessment. And so I heard that from all the different presentations here, how you are working on that and how that may be a challenge in some introductions. As you know, the Pfizer vaccine, so the one that has been one of the first that has been rolled out, is requiring very cold chain, so -20 to -60 to -80 degrees. This is a stretch. This is really difficult. Some of you have been involved in the Ebola rollout of vaccine, know the challenges that there are, and it cannot be underestimated. This vaccine also comes with a diluent, which is a part, so you need to have the right diluent and use that. It comes in new syringes of not 0.2 ml, but at 0.3 ml. So there needs to be specific syringes for that vaccine and a specific diluent and the cold chain, which is different. So I know that many of the countries in the COVAX facility who have who have now sent in their vaccine request form to the COVAX facility actually say that we don't prefer to start with that vaccine because it will be too complicated for us. So I think that is key. I mean, if we can't handle these vaccines in a safe way, all the way to the patient, to the one that is getting vaccinated, we can't start the delivery. So that is one first step to take right now, and is part of the National Deployment Vaccination Guidance. And you know this very well. It's really one of the key things. Apart from what you were saying before, the community engagement, the training of healthcare workers, the acknowledgement of safety monitoring systems. And at the national level, it's also about the regulatory approvals, which will be maybe a stopper or a go, so that the regulatory authorities in your countries have a fast approval when the vaccine comes, so that the vaccine can be rolled out pretty quickly.
Thank you, Anne. Alumar Umar has another comment which I wanted to share with you, and that is, so he says, COVID is like an exam which all public health staff will take at the same time. It is a test of science to be aligned with nature. We haven't heard yet from Charlotte Mbou, and I'd like to turn to Charlotte. She's a member of the Peer Hub team and of the Geneva Learning Foundation. Charlotte, you've been listening. You yourself have worked for your country's EPI program. What are you feeling? We've talked a lot about the technical aspects of the pandemic response, but what are you feeling and thinking as you listen to this dialogue between people from countries, immunization staff from countries, and the doctor from the World Health Organization who's been asked to get this done, to make it happen in the coming year to deliver the vaccines? Charlotte, how are you doing, and what would you like to share?
Thank you very much, Reda. I'm doing okay, and it's good to have you with us. And it has been a very interesting session, but also enriching. I've just been drinking in everything you have been saying, because it's very important for the times in which we live. And also looking at the flow of questions that are coming in from the chat, Reda, and identifying with them. And most of them have received the answers from Anne, and we are really grateful for that. And while other peers, members of the Peer Hub, have been speaking, I identify with them, and also looking at my context. But one thing I really wanted to pay attention paid attention to was a comment that said, okay, now the question of vaccine hesitancy that keeps coming up. And then, but looking at the opposite situation where demand could be higher than the supply, and since at the first world out, they have some specific target groups. Are we looking at strategies to communicate in a way which immunization professionals could tell people that come to ask for the vaccine when they are not yet eligible? They're not part of the target group, how to communicate with them to get them to understand that it's not yet that turn. They have to wait for that. That's for starters. And then there is the question of cost. I think of our third world countries. Most often we have Gavi that's supporting them. Now with COVID-19, seeing that the target population is not the same as for routine immunization, who pays for the vaccines, who pays for the training, who pays for communication, and all of that. So basically, those are some of the few questions that have been going through my mind while listening to you, and also going through the chat, seeing what members of the Peer Hub have been asking here in the Zoom room. Thank you.
Thanks, Charlotte. Before we go to Anne for an answer, I'd like to add a trick question to that one. So there is money and there is people and their capabilities. What, in your opinion, which one of the two is the biggest challenge, and why?
Ooh. Thank you, Charlotte and Reda. Those are advancing our discussion today. Good questions. Thank you. I think what you're saying is key in the beginning, Charlotte. So in Q1, the first months of 2021, the supply will probably be lower than the demand. So we will need to prepare for that, facing that situation where we don't have enough vaccine doses for all of the people who want to take the vaccine. So that poses first a question even on security. How will you guard and be careful with the vaccines, that they are delivered? And the principles I think we're talking about here is solidarity for the most and the highest priority groups, that's still going back to the frontline healthcare workers that are being at risk of being infected themselves and also transmitting the COVID-19 vaccine to others while they're doing their healthcare professional. Another principle is really the equity issue. You know, you would want to really give an opportunity to protect the most vulnerable first. And I think we all need to ask people to have that sound conversation with themselves. You know, who do we want to protect in our societies? Definitely the healthcare workers who've been doing such a fantastic work during this pandemic to take care of the patients and are at risk of their own lives and has been paying the highest price. So proportionately, more healthcare workers than any other working occupational groups have been sick and have been dying from the COVID. So really, solidarity, equity, the target groups should be respected first, and try to make sense in the language with each one to say, please give the vaccine not to your 25-year-old daughter or son who's healthy and can actually cope with the COVID-19 vaccination, but to the grandmother, to the grandfather who has a heart problem, and protect those most weakest groups first. I think we need to continue that language. On the cost side, this is very tricky and it's very key. I think will be the one thing, well, maybe equally important, Rita, as the people resources we have. The two of them go together. First of all, the cost piece. So the COVAX facility works as such. So you have the the AMC 92 countries who are part of the COVAX facility that will be probably getting the vaccines to cover 20% of the population for free. This is dependent on the fundraising efforts that are being done right now. So there has already been a few billion US funded, but we need more. So the fundraising is ongoing. If they're successful, all the AMC 92 will get vaccines, only the vaccines for free through the COVAX facility. If they don't succeed in the fundraising, there will be a co-financing. And both the co-financing, but mainly, and this is really key, the operational costs you were talking about, the training, the per diem, the logistics, the cold chain, all of this will have to be financed either by domestic resources, and probably part of it by domestic resources, but also it's really key that your national programs, and some of you represent those, are in close collaboration with the World Bank and the Asian Development Bank and other funders who can look at your costing of the rollout and be able to map that with grants or loans from World Bank or from Asian Development Bank or covered by domestic financing. I think that is very urgent because we know unless we have those operational costs in place, it won't happen. One piece as well, which will be costing, is the protective material for healthcare workers. So the IPC, the masks, the social distancing, all of that equipment that needs to be done in place just to safeguard all people around the immunization events will have to on it, and the cost of the IPC will also have to be covered in the operational cost. The people. So already healthcare workers around in every country of the world have been really challenged and stretched by the COVID pandemic, right? You all have been mobilized. We all have been mobilized as public health people into the response. So either a lot of healthcare workers have been deployed into responding or been sick themselves. Many have died. And now we're working with the same people who actually have to make the effort of the introduction of the vaccine as well. So I think we have to all be mindful that this year 2021 will be a stretch for all of us going forward. But what is the alternative? We want to halter and hamper this terrible pandemic. So we just have to roll up our sleeves and all help together to get the work done. There will be a shortage of healthcare workers in many places. So the way you can do, and I think you already thought about this, is really getting in the students, volunteers, maybe retired healthcare workers, maybe get the military involved in the protection and the organization and logistics of it. I think this is not just for us immunization systems, it's for all in the country. We need to work across the different sectors in the society and get all hands on deck. There will be a shortage for people. I agree, Reda, that is a key one. But cost and people, both of them are equally important.
Thank you so much, Dr. Ann Linstrand from the World Health Organization. I'd like to ask you, even if you are in your office and you're alone and your colleagues are going to look at you funny, just to put your two hands together for the people in this room that we heard many voices or several voices from countries who explain how they are thinking and already taking action to prepare for COVID-19 vaccine introduction. So please put your hands together. Let's see if we can make some noise wherever you are. That's better. So we're reaching the end of 2020, but it sounds like 2021 already has some excitement in store for people who work in immunization. I do see many technical questions. For example, Muluken Tesfaye, who asks, how does one dose vaccine will cost and how many doses needed per person? I'd like to point you to the WHO website and the WHO resources. That is the sole best, most reliable source of information. There are many more questions, of course, than we could address in an hour. So I want to thank you for your patience and hope you're not disappointed if you did not get to present or receive an answer to your question. We know there's an ongoing effort by WHO around communication, and we point you to those resources as well. Before we go, I want to remind everyone that this afternoon, so just in a little bit, we'll have part 2 of a mini-series. So this is must-see television. Join us. It's 15 minutes if you're interested in the topic of sero-surveys. And then tomorrow, we'll be having a COVID-19 Peer Hub workshop with Professor Heidi Larson from the Vaccine Confidence Project to discuss the topic of vaccine confidence. That's it for today. We're going to do a rewind of all the comments that we received throughout this session, or at least some of them. Thank you so much for having joined us, and thank you to Dr. Ann Linstrand, who took time out from her busy schedule, as you did with yours, to join in this dialogue that we hope we'll see more of next year. Thank you, and goodbye.